Have you ever looked in the mirror and become preoccupied with the perceived flaw in your image, like your nose being too big or your eyes being too small, but forgot about it moments later? Now imagine constantly thinking about these flaws throughout the day. This is what someone with body dysmorphic disorder struggles with on a daily basis. Body dysmorphic disorder is a mental illness that causes you to become preoccupied with a flaw in your appearance that's either minor or imaginary. And according to the Journal of Psychosomatic Research published March 2015, the prevalence of body dysmorphic disorder was found at a rate of 2.4%. Being a friend of someone who suffers from this mental illness, I personally witnessed what they struggle with on a daily basis. Learning about body dysmorphic disorder will help us get a better understanding of what they go through on a daily basis. First, I will talk about the causes. Second, I will talk about some of the symptoms. And lastly, I will discuss some treatments. So first, let's talk about the causes. In order to understand why body dysmorphic disorder affects 2.4% of the adult population, we must understand the causes. According to the Mayo Clinic Family Health Book 4th edition, published in 2009, the exact cause of body dysmorphic disorder is unknown, like many other mental illnesses, but do result from three main causes. These three main causes are brain differences, genes, and environment. Specialists have found that brain differences such as brain abnormalities and neurochemistry play a role in causing body dysmorphic disorder. Other studies have shown that there is a gene linked to body dysmorphic disorder, making it more common in people whose biological family members hold the illness. Lastly, environment, such as life experiences and culture, can contribute to body dysmorphic disorder, especially if it involves a negative experience in your self-image. So now that we've talked about the causes, next we'll talk about some of the symptoms. In order to fully understand what someone with body dysmorphic disorder goes through, you need to know the symptoms. Body dysmorphic disorder can cause you to become convinced that there is something negative about your appearance that is not true. This concern can dominate your entire life and cause you to become antisocial due to extreme self-consciousness. The main symptoms of body dysmorphic disorder are preoccupation with appearance, frequent examination of mirrors or complete avoidance of mirrors, strong belief that you have a defect that makes you ugly, antisocialism, the need to cover up your flaw with makeup or cosmetic surgeries, belief that others notice your appearance in a negative way, and avoidance of pictures. So now that we talked about some of the symptoms, next we'll talk about the treatments. Although this is a mental illness and treatments are very difficult, the Mayo Clinic Family Health Book has discovered that there are two main treatments that are most successful. The first main treatment is cognitive behavioral therapy. This therapy focuses on teaching you about your conditions, feelings, thoughts, moods, and behavior. The knowledge you gain from this therapy will help you to see yourself in a more realistic and positive way. You also learn healthy ways to handle your urges, such as mirror checking and how to slowly involve yourself socially. The second main treatment is medication. According to the Food and Drug Administration, they have not yet approved medication specifically made to treat body dysmorphic disorder, although there are alternatives. Medication used to treat depression are also effective for body dysmorphic disorder. Recommended medication is selective serotonin reuptake inhibitors and antipsychotic medication, which are antidepressants that help control your obsessions and repetitive behaviors. Ultimately, it is important to discuss body dysmorphic disorder in order to better understand what people who suffer from this disorder struggle with daily. First, I talked about the causes. Then I described some of the symptoms, and finally I discussed the treatments. So, I hope that when you decide to make fun of someone's appearance, you will think twice, because they can be someone who struggles with this mental illness, and your joke can cause them to take a step back in their recovery. So don't do it.